So good evening, my dear student. I hope I am audible and visible. Is everything okay? Okay. So as we have promised that every Monday and Friday I will be taking a 10-minute small session, and that will be on the physiology concept. So I am here for that. And today's topic is BP regulation, regulation of blood pressure. So this question can come as a clinical case. This question can come as a long question as well as a short topic. BP regulation. So what is blood pressure? We know the lateral pressure exerted by column of blood on the wall of artery is called as blood pressure, and how it is regulated. So there is an immediate regulation and there is a long-term regulation. We know that in the immediate regulation, basically there are three mechanisms. It's just a revision class. So there are three mechanisms. One is baroreceptor, second is chemoreceptors, and third is CNS ischemic reflex. Okay. So like that, we will discuss every Monday and Friday. It will be taking only 10 minutes for you, but it will be a revision for everyone. So first is baroreceptor, then chemo, and then CNS ischemic reflex. In baroreceptor, if I ask you how many receptors are there in the baro, there are two. One is called as aortic sinus, other is called as carotid sinus. Remember, they are not body. Baro are not body, they are sinus. So there are two baroreceptors. One is aortic body, sorry, aortic sinus and carotid sinus. Remember, they are sinus. Body are chemoreceptor. Okay, baro are sinus. So these are sensitive to pulse pressure or mean artery pressure. They are most sensitive to. What is your answer? They are most sensitive to pulsatile pressure, the pulse pressure. And the mean artery pressure when they are working, it is between 70 mm of Hg up to 160 mm of Hg of mean arterial pressure. So when your mean arterial pressure is normal, like 90 to 100, they are firing. But suppose if BP is high, what will happen if BP is high? If blood pressure is high, stress will be more or less. Stress will be more. So firing will be more or less. Firing will be more. So whenever our BP is high, stress will be more, firing will be more, and what are the cranial nerve which are working like a afferent? Answer is ninth nerve and tenth nerve. There are two cranial nerve called as buffer nerve, ninth nerve and tenth nerve. So they will take impulse from the carotid and aortic sinus, and they will reach a place in the medulla. What is that place called as? Anyone? Yes, good evening. That place is called as nucleus tractus solitarius. That is called as nucleus tractus solitarius. Now your BP is high, so you want to decrease the BP. So you will cause inhibition of the sympathetic stimulation and stimulation of the parasympathetic stimulation. So sympathetic stimulation will be inhibited. I mean vasomotor center will be inhibited and cardiovagal center will be stimulated. So vagus nerve will be stimulated because you want to decrease the BP. BP is high. So when BMC is inhibited, there will be vasodilation. And when CIC is stimulated, what will happen? If CIC, vagus nerve is stimulated, there will be bradycardia. So when BMC is inhibited, vasodilation, and when CIC is stimulated, there is bradycardia. So vasodilation and bradycardia will cause decrease in the blood pressure. So once again, let me recap. So whenever BP is high, firing is high or low, firing is also high. And this firing will be taken by which cranial nerve? Ninth nerve and 10th nerve. Where in the medulla? They will go to the nucleus tractus solitarius in the medulla. Now in the medulla, okay, they will judge the BP is high. You want to decrease the BP. So in that case, what will happen? You will inhibit vasomotor center, causing vasodilation. Causing vasodilation. And you will stimulate the vagus nerve. And whenever vagus nerve is stimulated, it causes bradycardia, and this will lead to decrease in the blood pressure. This is scenario number one. Scenario number two: if BP is low, then how baro will work? If BP is low, then stress will be low, firing will be low, and again ninth nerve and tenth nerve will go to nucleus tractus solitarius. Now BP is low, you want to increase the BP. So now we will stimulate BMC. We will stimulate vasomotor center and we will inhibit vagus nerve. When you stimulate vasomotor center, there will be vasoconstriction and there will be tachycardia. So by vasoconstriction and tachycardia, there will be increase in the blood pressure. So this is how baroreceptors are controlling your BP. If BP is high, they will bring it down. If BP is low, they will bring it up. Second number is chemoreceptor. So number one is always baroreceptor, and number two is chemoreceptor. So what are the chemoreceptors? You know already. They are the body or they are the sinus. Yes, you can comment also if you want. What about chemoreceptor? They are body or they are sinus? Pyro are always sinus, and chemo are always body. They are carotid body and they are aortic body. So there are two chemoreceptors. One is carotid body, another is aortic body, and both of them have a chemosensitive cell. What is that cell called as? That is called as glomus. And glomus cell is sensitive for hypoxia. Why? Because they have oxygen sensitive potassium channel. So whenever there is low BP, automatically there will be hypoxia. And hypoxia will stimulate oxygen sensitive potassium channel. So hypoxia is going to stimulate oxygen sensitive potassium channel, and this is going to increase the respiratory rate as well as causing vasoconstriction, increasing the blood pressure. So who was the first to work? It was baroreceptor. Who was the second to work? It was chemoreceptor. So in the baroreceptor, they are the sinus, in the chemo, they are body, and suppose it is very low. Suppose there is a road traffic accident and someone is having lot of blood hemorrhage, blood is lost. Okay, baro will fail, chemo will fail. So who is the last to work? Answer is CNS ischemic reflex. Last to work is CNS ischemic reflex. I mean, when BP is very, very low, when mean arterial pressure is even less than 40 mm of Hg, our brain will undergo ischemia. And for the first time, vasomotor center is directly stimulated, causing most severe degree of vasoconstriction. And this is the last attempt to save the life. That is why it is called as last ditch stand. This is called as last ditch stand. Okay. So this was about the immediate control of blood pressure. When we talk about the long-term regulation of BP, it is RAS, renin, angiotensin, aldosterone system. Whenever BP is low, JG cell of the kidney will release renin, and in the liver, angiotensinogen will be converted into angiotensin 1. In the lung, there is an enzyme called as ACE. ACE will convert angiotensin 1 into angiotensin 2. And this angiotensin 2 can cause vasoconstriction. It can release aldosterone, ADH. So by releasing ADH, by releasing aldosterone, aldosterone will absorb more and more sodium. And by causing vasoconstriction, they will again increase the blood pressure. So this is called as long-term regulation of BP. I will not take much of your time. So this is it for today. Again on Friday at 9 p.m. I will begin live. Okay.